Okay, today we can talk about the Reter syndromes. First of all, we should talk about the Reter syndrome's definition. It is a post-infective condition. Which is clinical triads. Okay, it has three triads. We can talk about the triads. Number one is arthritis. Number two is conjunctivitis. And number three is urethritis. So these are three clinical triads of the Reter syndromes. Okay, so for, the next one is we can talk about the etiology. In etiology, as you know, it is a post-infective condition. And like if about 1 to 3 weeks after the infections, and it is transmitted by the sexual transmitted infections like chlamydia. So the next thing is we can talk about the clinical features. Normally it infects to 20 to 40 years, and male to female ratio is 2:1. So the symptom is like fever, malaise, anorexia, and sometimes is like constitutional upsets. So in arthritis, so first of all we can talk about arthritis. So it's like sudden onset spondylitis, sacroiliitis, plus it's also involved the peripheral large joints. We can also talk about what drugs we can use for the peripheral large joints. So the next thing is conjunctivitis. In conjunctivitis, really red eyes, and one thing we should note about that is bilateral. In all other degree of red eyes, they are unilateral. Okay, the next and the last thing is urethritis. In urethritis we can find the symptoms like dysuria, pyuria. Okay, now we can talk about some investigations. In investigations, HB decrease, ESR, CRP is raised because it includes the arthritis. So normally rheumatoid arthritis factors, RA factors, is negative because it involves our joints. We can also X-ray is also very helpful in this case. So mostly it's acute, but sometimes it's may chronic. So now we can talk about the treatments. In treatment, mainly physiotherapy and answers like that. So we can use steroids too, intra-articular injections, but you should must remember that it's only used in the case of the peripheral joints. So in the case of if it's chronic or relapsing, we can use the methotrexate. methotrexate, or we can also use the sulfasalazine. So these are the treatment. Sometimes we can use the antibiotics like tetracyclines. So this is the Reter syndromes. So it's very important, like it's the definitions, it's the post-infective conditions, classical trials like arthritis, conjunctivitis, and urethritis. In etiology, we can talk about that it is a post-infective conditions. Clinical feature: 20 to 40 year age, male, ratio female 2:1, fever, malaise, anorexia. In arthritis, it's sudden onset, spondylitis, sacroiliitis, or it also involve the peripheral large joints. In conjunctivitis, it's cause the red eyes, bilateral. In all other degree of red eyes is usually unilateral. In urethritis, dysuria and pyuria. Investigation: hemoglobin decrease, ESR, CRP raised, RA factor negative, or we can have X-rays helpful. So treatment is like physiotherapy, steroids, intra-articular injections only in the case of the peripheral joints. If it is chronic or relapsing, we can use the methotrexate or sulfasalazine, and antibiotic we can use the tetracycline. Thank you.